Hey, I made a video on this topic just the other day, but I think this is an even better example, so I'll probably take that one down. Um, I have to show you, I think, something that's really helped me with my aligner treatment. Here we have an adult, class 2 end on, lower teeth look straight, and she just has some protrusion and flaring beyond probably what the final result was, which probably had some overjet because you can see she's class 2 end on. This patient only wants to have these spaces closed, and you can see the sum total of the spacing is not much at all. We've got a total of about, let's say, 2 millimeters, and we have the space to retract. Now, I'm not going to show you a Ceph. I think if you're an experienced orthodontist, even a general dentist providing Invisalign, you could see that these teeth are not retroclined, not upright. Now, if this was an extraction case and we had to do a lot of retraction in the order of, say, 7 millimeters per side, we might be concerned about torque control. The clincheck is programmed to move these teeth bodily. And you can see that because you can see the angulation isn't changing. And you can also look at it from the occlusal view. And if you look at the cingulum or gingival area on the palate of the uppers, watch how the teeth move back, and you don't see any really much more surface of the buccal from start to finish. Now, this again is nice torque control, which would be more important if you had a long range retraction or if you had very upright teeth. But tipping, we all know, is much easier. And one of the problems when you try to move teeth back with torque, it does tax your anchorage with aligners, and you quite often will see that characteristic mesial kind of tip of these teeth, whether you put an attachment on or not. And so what I do in these cases, I'm going to modify this clincheck, and I'm quite simply going to move these teeth back in more of a tipping manner. So what I do is I remove the palatal root torque. This will make things easier with less resistance. We can afford to have a little tipping in this case. We almost want there to be tipping because we're only retracting a small amount, and we want that to have a nice effect on reducing that overjet. Now take a look. Just that simple little tweak. Can you now see, you can see a certain degree of the buccal aspect of the upper centrals, and now can you see more? This is more of a realistic round wire tipping, which will be much easier with aligners without any sacrifice to this result.